Dear all, I am Dr. Ahmed. I am a neurologist in the UK. I am preparing this video to increase the awareness of coronavirus. It all started when I had coronavirus myself and had prepared a video in Bengali to raise awareness of this condition and how people can be helped. That video was liked by several people. It is in YouTube, and I've had a very positive response from a number of friends, family, and various other people. Another reason why I'm preparing this video is at the request of friends, family, and few of my friends in school plus college life have unfortunately had COVID, and they have specifically requested me to prepare a video and also to answer some of these questions related to this particular condition. Again, I am not a neurologist. I am a neurologist, not a respiratory disease specialist or a coronavirus specialist, but I have researched it myself, having suffered this, and also have gone through a number of research articles, including CDC, the Lancet, and also I'm a member of the Indian Scientists' Response to COVID, which is INDSCI-COVID. Again, that is a massive response from the scientists of India who are trying to remove myths about this condition, the false news about this disease. So a number of people have approached me to try and give valid information about this disease. I will, of course, give my first-hand account of what I felt when I had the disease, but I will specifically mention that in the video, whichever is my experience, but majority of it is researched from the journals that I've mentioned earlier. So the first thing to do as a doctor is to explain these issues in a very simple term so that a layperson can understand. And in order to do that, I have to simplify how the disease attacks you, how it affects your body. And in trying to explain that, I need to divide this disease into a few stations. Again, this is my experience. This is not from any journal, but you'll find that over the course of the video that many of the researchers do use this type of stationing, and that will help the common people try and understand this disease. As you know, there is a number of articles, information all out in the internet, but it's very difficult for the common people to really get a grasp of what's going on and what they should do. So the first thing is to know, and as you all know, that coronavirus attacks your body from the face. So your nose and your mouth are the attack zones, and that is why safe distancing, physical distancing, using masks, hand washing for 20 seconds, using 60% alcohol gel, etc. will help prevent. The second station that it goes through is through the throat into your nasopharynx, that we call the nasopharynx, and then into the chest, and then it spills into the blood. When it goes into the blood, that's when the body is trying to fight the virus, and in doing so, it goes into a total disarray, a total chaotic situation, which is called a cytokine storm. So that's a body's overreaction to fight the virus, and it's an auto-destruction by producing a lot of chemicals. So the body produces a lot of chemicals and which the body has no control on. So it is interleukin 1, interleukin 6, tumor necrosis factor, and a number of other chemicals which can damage your body. I'll come to that in a minute. And this cytokine storm is responsible for multiple organ failure in your body, including your lung, your kidneys, your heart, your brain, and so on. I'll touch base later. But you just need to understand in simple terms, this is my experience, that if you divide it into the stations, as said, from the face, the throat, the nasopharynx, the chest, and the blood, it will help you as a layperson understand the disease. Now we come to CDC. CDC has divided the disease into 5 major categories, and you will see that the staging of the disease is roughly the same as I described to you the stations. So the CDC divides it into asymptomatic, so patients who actually do not have any symptoms, they're lucky people, but they spread the disease. Number 2 is mild, number 3 moderate, number 4 severe, and number 5 is critical. Now, obviously the serious ones and the critical ones are in hospital. That's for definite, but the other ones may be in hospital, may be at home. So the moment it involves the lung, creates that cytokine, goes into the blood, it causes a cytokine storm and affects multiple organs, then you are in hospital. So that's how the staging works. So if it is in your nose, nasopharynx, mouth, before going to the chest, you will get flu-like symptoms. And so the symptoms of this disease that you get initially, which is mild to moderate before entering your chest, will be just like flu-like symptoms, including fever, chills, myalgia, sore throat, a bit of headache or severe headaches, and you'll have nausea, vomiting, and also runny nose. The moment it goes into the nasopharynx, you can get cough, or even when you go to the chest, you will get shortness of breath along with the cough. And thereafter, due to the cytokine storm, you can get multi-organ issues, including the heart, kidney, brain, as I just told you. But the center of the problem is the lung. As you all know, at this stage, that the lung is the most important organ in this particular infection. Now, few things before I move on to a separate issue is, when will you definitely land up in hospital and you need medical help, is when you have trouble breathing, when you have got a pressure or pain in the chest, and when you have new onset confusion, or you have difficulty keeping awake, or you don't wake up in the morning, or have cyanosis or blue lips. Then these are the conditions, the 5 conditions where you definitely need medical help. The next issue is few facts regarding this disease. The good thing is 80% patients will be mild to moderate and will get better. 14% will have severe disease, and 5% will have critical disease. Now, as I explained, it depends on the staging as well. Now, if you take into account the timelines, so a patient getting an infection, or a person getting an infection through respiratory droplets, etc., they will develop shortness of breath in 5 to 8 days. So initially they might get symptoms of sore throat, as I said, and as the route from the mouth to the nasopharynx to the chest and spitting into the blood comes into this timeline. So you see shortness of breath presents in 5 to 8 days. They developed respiratory distress syndrome in 8 to 12 days, and these patients land up in ICU in 10 to 12 days. Again, this is the majority of patients as reported by CDC. Doesn't have to have a timeline, so a patient may have sore throat and within 3 days may develop pneumonia, but that's the minority. But I'm just telling the normal or the most common scenarios. The important thing to note is this infection. 98% patients will have symptoms of COVID within 12 days. And they have the median hospitalization time of the survivors is around 12 days. Now, those who get admitted to the hospital, a third of them will need intensive care, and a third of them who need intensive care, unfortunately, will succumb to the disease. Now, I just want to emphasize on the lung involvement. As I said, the lung is the most important issue in this particular infection. And as you can see that around 3 to 17% patients in the general population will have ARDS, which is acute respiratory distress syndrome. Those patients who land up in hospital, obviously, they will have more lung involvement, and around 20 to 40% patients presenting to the hospital will have ARDS. The number will obviously be higher with people who are going to ICU, and around 70 to 85% patients will have ARDS or acute respiratory distress syndrome. The patients may also get kidney involvement commonly, and around a third of patients may have acute kidney injury. And around 20% will have cardiomyopathy. They might present with a number of other cardiac issues, because another problem with this disease is hypercoagulability, i.e. your blood gets very thick, and with this regard you get clots everywhere. I mean, say you have pulmonary, i.e. lung clots, you've got clots in the brain causing stroke, and various other areas where you can get clots. So I'll come to that. How will you deal with those situations? Now, apart from the symptoms as I described, starting from your sore throat, going to the lung, there is another one which is very commonly seen in children, which is a Kawasaki-like disease, i.e. a mucocutaneous syndrome involving multiple lungs. So a child may present with a rash and be very unwell with it, and that is a multisystem inflammatory syndrome that is being seen in children. This was a much later finding. And also to add, when you have the sore throat, you can get a loss of taste and smell as a presentation. Now, again, coming back to the presentation, the good news is 80% will get better on their own. But having said that, it's not easy. Out of that 80%, many will need to go to hospital, many might manage at home. So my basic issue is what can be done at home and what can be done in the hospital. When you go to hospital, the majority of patients will get better with ward oxygenation, ward oxygen therapy, or NIV, which is called non-invasive ventilation, and a few of them will need ventilator or extracorporeal membrane oxygenation and other forms of oxygen therapy, basically. Now, the issue is how, as an individual, will you manage this problem? And therefore, that is the basic reason to do the video of what, as an individual, you can do. I've tried to explain the progression of the disease in the earlier part of the video, and now I'm going to focus on what you should do. So my mantra that I will give is a very simple 3-step approach, and the 3 P's. First of all is prevention. So the prevention will be using masks, hand washing, be vigilant about common things that you touch every day. For example, the doorknobs, the computer, the mobiles, your boxing gloves, or no matter cycling equipment, etc. You will have to use either alcohol gel or have to wash them with soap. So those are the preventative issues. And of course, physical distancing comes there as a very important step. Then the second P is prepare. Now this will prepare you at home and also if you land up in hospital. And what do I mean by prepare is keeping yourself as fit as you can and do some breathing exercises. As I told you, the lung is the primary organ that is involved in this case, and it is very important that you try some breathing exercises. Now, the breathing exercise is not going to cure you, but it will give you a better chance to deal with this condition, or even if you land up in hospital, your chances of getting off the ventilator or not getting a ventilator will be higher. Now, I'll come to this preparation issue and the breathing exercises in a minute, but I'll go to the other side. The other P is patience. Now, the important thing to note in this condition is that there is no cure till date. So basically, you're fighting a beast and you have no cure. So it's like, I'll just delve into an analogy that you're fighting a boxing match with Tyson. Why I use this analogy is Tyson is back. And the second issue is there are 12 rounds as in boxing. As I told you, the median hospitalization or the median disease duration is around 12 days. So if you are able to withstand this 12 days, then you are in a good chance that you're going to survive this disease. And of course, you have to prepare, as I mentioned. So basically, you are in a boxing ring with Mike Tyson, but your hands are tied. There's no cure. So all you can do is a bit of dodging, but you have to be fit and stand those 12 days. What can you do if you get the disease? Is your body will tell you. For example, I had immense thirst. That was to drink plenty and plenty of water. That will help, no doubt, to wash the virus from the nasopharynx. Plus, it will prevent you having kidney injuries, hypotension, etc. What are the other things that have been studied? Say, for example, vitamin D is a low-hanging fruit. I feel that there's no harm if you take vitamin D at a dose of 1,000 units per day. And if that helps, now it will not cure your condition, but some of the studies have shown a benefit, so there's no harm taking it. Same with vitamin C. Again, there is no clear evidence, but some of the papers have mentioned it, and there's no harm taking vitamin C. But beware, please don't overdose. Say, for example, in various places there have been overdoses of people taking garlic. And also people taking various other foods to try and improve the immunity, and as a consequence they have landed up in hospital. So few of these issues, they need to be very careful of where you're getting the information from. So for example, in Iran there was a report of methanol poisoning where they were taking it to prevent the disease. And again, same with having hot drinks. People have burnt their throats trying to prevent this disease, which is, there's no reason about that, and you cannot kill the virus by taking hot food or hot drinks. So coming to the breathing exercises, which will help you prepare your body either to manage the symptoms at home or even if you go to hospital, you will have a better chance to come out alive. So the breathing exercises are quite a few there, as I found in the internet and speaking to various other friends. But two of them are very easy exercises, which I think everyone should do. Now, these are basic breathing exercises, which are called, number one is the stacking exercises. So you put your hand on your abdomen and try and take a deep breath. Feel the abdomen pushing out or expanding, and then keeping the breath held, put your hand on the lower chest, expand the chest, and then hold the breath, and then go to the upper chest and expand it, and then let go all of them when one go. Exhale it out. And you have to do this multiple times. The second exercise, which is very, very important because it helps opening up the airways at the back, at the posterior part of the lung. And this exercise is very helpful, again, from the internet. This is not my research. So you basically take a deep breath in, hold it for 5 seconds, and let go. And you got to do this about 5 times. Then you give a good cough again to your elbow, not hand. And then you have to lie prone, so on your chest, and take nice deep breaths in and out a little faster than usual. And you've got to do that 10-15 times, lying down prone. And that will help open the airways. So all we are doing with the breathing exercises is oxygenating your lung so that it can fight the disease. It's not a cure, but it will help. I'm not talking about athletes who do a lot of running, jogging. Probably they will not need this, but I'm speaking in for the vast majority of people who just does basic exercise. I think the breathing exercises will definitely help. It did help me, and I'm sure it will help you. Not all patients are healthy. There are other issues like various other comorbidities, including cardiac, cancer patients, patients on immunosuppressants, diabetics, hypertensives, you name it, these patients are at a disadvantage. I think they should prepare and be extra vigilant. So my mantra, as I said, was prevent, prepare, and the third one is patient. So your patience is very important. You are fighting the boxing match with Tyson, and you have to withstand those 12 rounds. That is the most important thing. And so you've got to be patient. You know, when your sore throat comes, in my experience, you might get a very strangulating feeling. But believe me, if you're able to fight it out at home, you've got a good chance that you're going to survive this disease. Now, what are the ways we can move forward? Now, since my last video, obviously we are getting out of the lockdown, and quite a few issues will come up. We don't know how we will fare. So few of our patients, our friends, have asked me to give some epidemiological information. Would be very grateful if you could look in the in Sky COVID website, where they've got beautiful epidemiological studies, and that will help you. I won't delve too much into that, but just to let you know that the R value, i.e. the number of people one patient can infect, is very important. And in India at this point, it's 1.26 to 1.27. UK is going over the peak, so it's under 1 now. And another thing to note in this epidemiological issues is the doubling time. The higher the doubling time, the better it is, which means that you're preventing the growth of the virus. So currently in India, the doubling time has come up to 15 days from 4 days initially. So it's good that it's gone up to 15 days now. Again, the important thing to note is we know very little about this virus, and the more we have studies, then only we'll be able to tell these um, numbers in a more meaningful way. So, how do we move forward in managing this disease? Let me tell you, coronavirus is going to stay there forever. Um, it looks, unfortunately, that is the truth, but we have to change ourselves of how we work, how we live, how we are at home, etc. The first thing is obviously everybody's mind is in vaccines. Now, vaccines can take tremendous number of time to come out to clinical use. But there's good news there that some of the vaccine trials are going very well. This week in Lancet, there has been names of 3 clinical vaccines that are being trialed. And out of that, one from the Oxford group is going into phase 2, 3. And in this regard, it is a vaccine that has adenovirus, and it carries a prong, DNA for the spike antigen. So this COVID has a spike that enters the ACE receptors and enters your body, and that vaccine looks promising. We'll come to know better, but let me be clear, it's not going to be in the next few months. Those who are very, very hopeful are contemplating that may be out for clinical use by the end of the year, but some of them are very skeptical and they feel it might take a year or so before you can get a successful vaccine. So after the vaccine, obviously public health measures that have been already in place, now social distancing, or physical distancing, then wearing your masks, etc., become mandatory, and people should follow that. Then the third issue is hospital and ICU treatment. As I said, proning, lying prone and breathing, that is very important. And when you go to hospital, these are the issues that will be told to you to do. So why not do it from now? And that will help you. In here, I just want to mention about the phenotypes of the lung involvement. And the phenotypes of the lung involvement, majority of them, 85%, will have just mild symptoms, and they'll not need anything else, which is good. Their chest x-ray will be normal, their oxygen saturations will be normal, but 80% of the hospital patients might need some oxygen therapy, and a few of them will obviously need mechanical ventilation. And those who require mechanical ventilation, about a third will succumb to this disease, as I told you in the beginning. Then after the hospital management, we have anticoagulation coming up. So because of the hypercoagulability, or because of the thickness of the blood being increased because of various protein in this condition, there is studies that are coming up with people being anticoagulated by heparin to prevent multiple clots spreading everywhere. And the fifth issue is antiviral. So remdesivir, as you know, has been a drug which has been effective in helping patients who are in hospital in a serious state. It's not a cure, but it does help to a certain extent according to the recent data. And the sixth is the drugs that target the cytokine storm. I told you, when your body overreacts and produces a number of chemicals, it can lead to further damage. And there are certain drugs, interleukin-1 blockade has been studied, and that is showing some promising results, and that will help as well. So these are the things that are going on about this disease, but I just don't want you to be panicked. As I said, 80% will get better, and I've given you the information of how you can prepare yourself and have these 3 P's in mind. So prevention, prepare, and be patient. And of course, You need to know that the more fit you are, the better is going to be your outcome. And I'll come back later with other information as they come out for this devastating disease. Hope you like this video, and if you do, please share and like. Thank you.